Hello, my name is Bill Haley, and this is part of Haley2024, The Movement's Government Reform Ideas. This one's going to be on Social Security and Medicare. How do we take it to a free enterprise system? So, it can be done. Let's go through the system I've set up here. First, you need to know the complete competitive regulatory agency structure of government that I create. Is a citizen ownership structure of government or model of government with a CRA structure, competitive regulatory agency structure. So, how do we do this? All government power is separated into 30 sectors with distinct elected representative oversight per sector. We'll go over the 30 sectors in a minute, very briefly. But you see a little bit of the hierarchy here. So there is a hierarchy where the base unit is a CRA. They regulate you, they govern you, and they send representatives up to the sector board level. That's the representative level. Then the parent sector board, that's mainly organizational purposes that define the lines between the 30 sectors. So all current government power is separated into 30 sectors. Each one has a set of authorities and responsibilities. So let's go over this. So we get rid of government welfare altogether. We go to a charity model. That's separated into 3 sectors, plus I have family law and religion in there. The foreign protection system is 5. That's mainly at the federal level. The other 25 have main primary authority at the state level. Violent crime mitigation system goes dramatically to the free enterprise system, but that is going to be split into 5 sectors. We got healthcare, financials, insurance sectors, food sectors, education, manufacturing, human resources, identity, environmental laws, work safety, transportation, media and communication, land and water. We have 30 different sectors in here. Each one of these are going to have their own their own responsibilities and authorities. Now, you have this at the state level, federal level, and local level. Again, 5 with primary authority at the federal level, 25 at the state level. Now, 24 of these have primary authority at the CRA level, the smallest unit, and then 6 of them have primary authority at the sector board level, the representative sector board level. I haven't gone over all that. If you haven't read any or seen any other videos, I'll clue you in on a little bit more later. So, insurance sector is where Social Security and Medicare is going to be taken care of. Okay. A CRA is your basic unit. You have roughly 12 of these per sector at the local level, federal level, and the state level. So you have 12 of these. I pick mine. My neighbor picks theirs. Guy down the street picks theirs. Everybody is governed only by their CRA. I'm governed by my CRA. He's governed by his CRA. Guy down the street is governed by his CRA. Everybody picks a leader of their own CRA. So you join together with other people within your CRA. Hopefully they're of like minds, same political philosophy or governing philosophy. So if I want to be governed conservatively or liberally or however you want, whatever type of governance philosophy you want, I can choose whatever one I want. With 12 different options, you're gonna have significant differences. So let's go over this real quick. And the rating system, that's going to give high quality information from a lot of different perspectives. Because if you have 12 different rating agencies with a different philosophy of how you want to rate, you're going to have a lot of different perspectives. So let's go over this. In the current system, we have a lot of socialism. Social Security, Medicare, a lot of socialism in there. We want to move to a free enterprise system. Free enterprise always works better than socialism. Okay. I did a 3-minute introduction series into a lot of these areas, so I'm going to use the same slides, go over some of the same points. But I want one video to really touch on all the areas of Social Security and the transition. So yes, we have a huge transition. It's a big hole, a big financial hole. How we're going to get out of it. Let's go over that. Okay, first of all, the problems with the current system. Your money is not held in a special account for you when you retire. It's just not there. There's no money there. There's no overall big budget or a big pot of money somewhere. It's a pay-as-you-go system. There's zero there. They have a little bit of working capital. That's about it. They put enough in per week or per month to put out the monthly checks, and that's it. But you have to get money in from taxes at the same time so money can go out. There's no money that's left there in an account for you. They can say that they can give you a statement saying that you have enough money to give you benefits of $2,000 a month for your retirement. There's no money there. They're relying on taxes in the future. So they can say, no, we really have federal debt bonds out there. So the debt bonds are part of your capital. That's part of your resources. You have to collect taxes for that. So it's not there. Either way, if you want to say it's there, you still have to collect taxes. If you say it's not there, you still have to collect taxes. Either way, you have to collect taxes. Individuals do not have a right to Social Security accounts. The Supreme Court said it. They set it up in the 1920s as a welfare program because they did not legally have the constitutional authority to create a retirement program. They still don't, but the Supreme Court just said, okay, they let them through. They shouldn't have. It's not constitutional. It's not in the Constitution, therefore it's not constitutional. It's not one of the 13, 14, 15, whatever it is, authorities that the states gave the federal government when they set the federal government up, 1787, I believe it was. Anyway, okay. The benefit for future retirees depends on future laborers. It's a Ponzi scheme. It's a pay-as-you-go scheme. It's a bad way of going. And plus, every year, the life expectancy gets higher. This goes farther in debt. Or that's even a bad way of looking at it. It's not farther in debt. It goes farther into the future beneficiaries, the future Social Security beneficiaries are going to live longer. They're going to be paying out more. The numbers just don't work well when life expectancy goes up. And do we really want to give the same government to regulate healthcare as the ones that are in charge of Social Security? We approve a medication, and that's going to increase the life expectancy, let's say, from 78 to 79. Well, that puts a huge burden on Social Security. Are they going to approve it? Do we want the same people approving medicine and healthcare plans as people who are in charge of retirement plans? It's counterproductive. I mean, there's a conflict of interest, huge conflict of interest there. Okay, immediately spending all the contributions wastes opportunity to build capital. Retirement funds has always been one of the best ways to build capital in the capitalist system of America. In our economic system is capitalism, free enterprise. Capitalism just means people save something of worth. They created something with durable value that lasts a long time. Building capital means that you put money into a business. That business builds a factory, they build the machinery, and now the workers can be a lot more productive. It's like having a worker with a regular shovel versus a worker with a backhoe. The capital can build, if you have a little bit of capital, you get a shovel. A lot more capital, you get a backhoe. You can build a lot, you can do a lot more. One laborer can do a lot more with a backhoe than they can with a shovel. You're a lot more productive. Quality of life goes up when you build capital. When you don't have that capital built up, what do? You have you don't have as much high productivity. Your standard of living does not go up as high as it had that it could. So, anyway, so there's a dozen insurance CRAs. There's a dozen different ways of handling insurance. A dozen different ways of saving up for retirement. And there would be plenty of sectors or CRAs that allow you to create your own. So it's not just a dozen, but there will be plenty of CRAs that allows you to create your own way. You just have to get above a certain rating floor. We'll go over that in a second. Here's one of the best charts I have. So within each sector, we're going to talk about the insurance sector right here. We have a representative sector board level. Not much to be at the sector board level. There's not enough negative externalities within this that pushes up to the sector board level. Now in the rating system, we have a rating floor in the sector board level that forces people to get above a certain rating, not to become a burden on society. So you have to have a retirement plan. You have to have health insurance, especially for your minor children. You have to have life insurance, especially if you have dependents. There's a certain number of mandates you have to go above a rating floor. There's a lot of ways to get there, but you have to take reasonable steps not to become a burden on society, especially when you have dependents. Okay, let's keep on going. The competitive regulatory agencies are full governmental units. Again, these are the ones that you join, and then my neighbor joins another, and the guy down the street joins another. Each with a different philosophy. You can have a Republican type of philosophy, a Democrat type of philosophy. You can one will be controlled probably by Heritage Foundation supporters, and others by the Brookings Institute supporters. That's more of a conservative versus more of a liberal type of organization. So, then there, with 12 of them, that's just two. Those are two big ones. With 12, you can have a lot of different ways of how to regulate. Now, there's going to be a libertarian one too, where they're going to let you do what you want to do. The amount of regulations are going to be very minor, but they're going to have a mandate. Okay, you can do what you want to do, but you have to be above a certain rating because you have to. It's part of the citizen ownership model of government. To live in this society, you're required to fund the military. You have to have law enforcement contracts. You have to have a court contract to pay for the courts. You have to donate to a charity, contribute toward charity. Since it's a mandate, you can't say donate. You have to contribute toward charity. And you also have to take reasonable steps not to become a burden on society. Those are the rules of society that I want to set up within this full structure. Those are the mandates. If you don't want to live in this society, then you can go live in a different land. Now, obviously, there's a lot to that. I don't want to get into that too much. We should allow a couple other states to allow people who don't want the structure to go to those states and live within those lands. Anyway, and then they can do what they want to, with very, very little to no government or to a high levels of government. But you have to understand, a couple of these CRAs are going to be very statism, very heavy control, very socialist natured. Some are going to be very libertarian natured. So I think most libertarians who want very little to no government are going to like the system. But we should set some states off or some areas of land that those people can go to and not have to move out of the country. Anyway, off topic. That's a rabbit hole. Okay, let's go here. All government power is separated into 30 sectors. We went over that slide. We went over that slide. Very important slide here. No one person can serve in a position of official authority in more than one sector. There's 30 sectors. In more than one level, federal, state, and local. More than one branch, legislative, executive, or judicial. And they have to serve as a representative either in the sector board level, parent sector board level, or in the CRA. And then on the rating system side or the CRA side, the rating system is exact duplicate. You need the same number of people, same number of, you've got legislative, executive, and judicial in all three levels, in the parent sector board, in the sector board, in the CRA level. Everything's the same. So you have a lot of different, as you see that, our representatives are going to be dramatically expanded by dividing their power up. A lot more checks and balances within the system. Everybody has very unique authorities and responsibilities not so broad-based. You're not going to have one person in charge of education and over top of the police and over top of the military and over top of environmental laws. No, the people in charge of environmental laws, they're in charge of environmental laws, not education. People in charge of education, they're not in charge of the family law. All of that's split up, 30 sectors. Sector boards that will play a role. So there's 30 sectors. Who will play a role in Social Security? Family law, big time. Financial sectors, there's 2 of them. Both of them will play a big role. The insurance, obviously insurance is going to play a role there. In many aspects of insurance, by the way. Health insurance, life insurance, and there's a lot of insurances out there that's going to play a role. What we're talking about Social Security is social insurance about becoming a burden on society in your elderly years. Identification sector. We haven't gotten into that, but that deals with ownership and citizenship. So that's going to play a huge role. Human resources, that's labor law. We're going to get your employer out of most of everything. They need to concentrate like a laser beam on being the most productive and efficient at providing goods and services to the consumer that they are providing goods and services to. We don't want them micromanaging their employees. They have a compensation package and let the employee take care of all the different areas they have to go to. Right now, the human resources side of a business is way too large. They should just be paying money into the compensation package for the employee and let the employee handle the rest. Handle their retirement, handle their health insurance, handle all the areas that employers are trying to get into right now. And it's not just the employer's fault. Regulations and laws by the politicians kind of force it on them. We want to take it away from them, change those laws around. Now, I mean, you might go into a CRA that wants to push it back into the employer's realm. Hopefully not, but we'll see. Okay, the charity sectors are going to play a huge role as well because you are required to have reasonable steps not to become a burden. But reasonable steps means that some people will become a burden. When somebody becomes a burden, the charity system steps in. We don't want to have such strict rules that nobody can become a burden because you have to save up so much and put so many things into place that you never even have a chance to become a burden because that's overwhelming. The system has a balance there. Okay, let's keep on going. Retirement's ahead. Just my sign. Okay, private retirement planning. The individual through the free enterprise system can provide for their own retirement. That's basically what I'm trying to say. But there's a requirement that you do in one of many different ways. Well, you pick your way. Okay. Transitioning away from Social Security and Medicare. I did a 3-minute video on a lot of these points. This is putting it all together. So you see some of my slides saying 3-minute introduction. But here's the transition. Boy, oh boy, we dug a big hole. We dug such a huge hole, and we have so many obligations that are not funded right now. And how do we get out of it? Okay, I have a unique way of doing it. We're going to have a lot of good experts, a lot of good accountants, a lot of good actuarial tables to really try to figure out the actual numbers because that's not my expertise. But let's see what I came up with. Promises are turned into state debt. And those state debts are going to be paid for by probably a payroll tax. So we're going to take it out of the federal government realm, bring it back to the state realm. And it's going to go into the state debt. And they're going to use probably payroll taxes to get rid of that. Let's talk about that. Okay. We dug a big hole. How do we get rid of it? If you're under the age of 50, all promises are gone. You don't have anything. So let's say you're at 50, you don't pay any more taxes, and you don't have any money coming in from the government. All those promises are wiped clean. Now you have to start heavy duty putting money aside for your own retirement. If you're under 50, you still don't get any money. Anybody under the 50, you get no money whatsoever. But you have to pay taxes, that payroll tax, until you hit the age of 50. Hopefully you start putting money in as well as paying taxes. But when you're at the age of 50, all the way until you're age of 65, you do heavy duty savings for your own retirement. But we stop all taxes at the age of 50. Just the way I set it up here. Additional funds are for Medicare. So Social Security and Medicare, one big bundle, we put it together. So whenever I say one, I mean them both together. They're both a burden. We get rid of Social Security. We have a full health care insurance for the elderly. We need to build that insurance model. Because right now that insurance model is gone because government took it over. And it's not as good as free enterprise. It's not fair, but we dug a big hole. Join a CRA that gives you the money but takes taxes up from you. Okay, that's just a line I said. Some people are going to bellyache so much saying, no, they owe me the money. Well, go into a CRA. You're 30 years old. You've been paying it for 12 or 13 years. They'll pay you the money, but they're going to be taxing it back from you. There'll be a huge tax for that. That CRA can take care of that. Competitive regulatory agency, competitive governing agency. It's a silly way of doing it, but if somebody really wants to bellyache enough saying, no, I want my money, well, that's fine, but they're going to have to take it from you because they don't have it. They're going to have to take it from you to give it to you. In my system, you start getting benefits when you're 50 and above. So if you're 51, you want to get a little bit. 52, a little bit more. 55, more. 60, more. If you're already 70 and you've been getting Social Security for a while, you put enough lump sum into your retirement account to give you the same benefits package as you currently have right now. So let's go through this. Through the transition, the federal government will cease Social Security and Medicare, both taxes and benefits. Well, yes, the federal government will. The state government's going to have to pick up the payroll taxes to fund some of the system. The federal government dug a deep financial hole, and there's not a fair way out of it. The government will fund retirement accounts for those currently in or soon will be in the government programs, 50 and above. Again, age 50, you get 0. 51, just a little bit. 52, a little bit more. And so by the time, if you're already in the system, you get the amount lump sum into your account. Yes, it's debt, federal debt, but that federal debt turns into state debt because we don't want the federal government to hold debt. All debt goes down to the states in my system. You can look at my debt page on that. Okay, funding for an individual retirement account progressively phases out at the age of 50. Basically what I've been talking about. So if you're 60, you get a lot. 51, barely any. Anybody under 50, 0. Okay. Additional funds deposited into IRA fulfill the commitment on the Medicare part. Kind of talked about that. It's lump sum. What do you need for your current benefits? So if you're 65, you're on Medicare right now, you're on Social Security right now, how much of a lump sum do we need to put into your account, your IRA type of thing, your retirement account, so you can have the same benefit package that you currently have right now. Now, a lot of people, they're going to have an account where it's an annuity, where you don't own anything at the end. When you pass away, let's say you pass away at age 72, it goes back into the system. There's nothing for your children or whatever. It's gone. Now, husband and wife will have a contract together that they keep on getting each other's, but because husband and wife should have one account, not two. Anyway, but some people will have an account where you can send it down to your children or your estate. Other ones, you don't. Now, obviously, if you want to have it go to your estate, whatever's left, you're not going to get as much money per month. That's just the nature of the game. Because if people die at age 69 and they collect it for only a couple years, and all the money goes into the account, and they know it, the actuarial tables will say we can give you a lot more money because once you pass away, we don't pay out any to anybody else. So it's just simple numbers. Okay, a private healthcare insurance market will emerge for the elderly. The funds will come from state bonds in proportion to each state's percentage of GDP. So all debt is going to go down to the states, and the states are going to be paying that off through payroll taxes. Now, each state can kind of figure out how they want to pay it off. I suggest payroll taxes. But the name of the game is every state gets to decide how they want to pay it off. Some might be real estate taxes, some might be estate taxes, some might be income taxes. Income taxes are payroll taxes, but they work a little bit differently. Some might be sales taxes or business taxes. However they want to do it, each state can do it. But my proposal is payroll taxes by state government to pay off theirs. Okay, states will use a payroll tax to pay off these state bonds with a 50-year payoff goal. There's a lot to that 50 years. You can look at my debt page to figure out where we can get some money. In the Haley2024 structure, the military goes private sector. Police officers go private sector. Education goes private sector. All the government assets within all those, that's a lot of assets. That's going to be a lot of revenue that we can use for the debt, to offset some of the debt. Maybe not all of it, but some of it. The monetary policy, we're going to have a unique way of rolling this into some monetary policy. It's a unique way. Look at my monetary policy, very unique. Okay, let's go. The transition away from government-funded education can help provide a funding source to help fulfill the Social Security financial hole. Look at my education page. There's going to be a lot of money coming out of the education sector because we put a lot of money into it, building a lot of buildings. A lot of we front load the expenses on education, and then people pay taxes for the rest of their life to pay that back. Social Security is the opposite. You collect taxes throughout somebody's whole working life, 40 or 50 years, and then for the rest of their life, you get the benefits. So it's the opposite of education. So we're going to take the assets from education and people paying back what the government did for them. If the government provides you an education, you should be paying that back as an extra tax, the education tax, and that's going to ultimately go into paying off debt, which a big part of that is the Social Security debt. Okay. No one receiving funding for their IRA from the government pays taxes. So that's why I have taxes stop at age 50, and then you start saving for your own retirement. Now, hopefully, you do both. You pay you pay that payroll tax, and on top of that, you save up for your own retirement starting at age 20, 25, 30, 35. But at age 50, there's no more payroll tax for you. You're 100% need to be focusing on putting a lot of money for your retirement. It is foolish for the government to tax the same person they are funding. So we don't tax somebody, then put money into their own IRA. That's foolish. So that's why we stop it at 50. Okay. Part of a citizen's responsibility is to take reasonable steps not to become a burden on society. Thus, the rating system mandates a minimum rating, the rating floor, for dealing with retirement planning. So you might have an adult child sign pieces of paper saying they will take care of their elderly parent. Well, the elderly parent now does not have to save as much money in their retirement funding because they're going to be relying on their children to take care of them in their elderly years. That's part of retirement planning. You have to have that contract. There's a lot to that. And that's just one way. You can build money into the charity economy. You can build capital into the charity economy. You can do a lot of different things to get above that minimum rating, the rating floor. Ratings will be highly dynamic with many rating agencies assessing the good and bad and informing the citizens. Many businesses and retirement models will be tried and constantly improved. When you have a free enterprise system, things get improved rapidly because there is many different methods being tried. When we have a government monopoly, Social Security, Medicare is a government monopoly way of saving money. It's a very horrible way of doing it. We want competition. Okay. It's easy to say, just let me out of the current system, let the people in the current system deal with that. That's a bunch of bunk because taxes still come from everybody. Well, no, get rid of my payroll tax as well. Still a bunch of bunk because we dug a huge financial hole. We need to collectively get ourselves out of that hole. And that's part of that 50-year payback on payroll taxes, stopping at age 50. Okay. Many business retirement models will be tried and constantly improved. Many sector boards will be involved in retirement planning. We talked about the different sector boards, from financial to education to insurance to charities. There's a lot of different sector boards. We already went over that slide. So cooperation and organization groups will be valuable. Organization groups are going to be groups that coordinate among a lot of different sectors to help coordinate to do big things. Reasonable steps are required. However, that results in some burden. We talked about the reasonable steps. Not to become a burden on society. The charity system will address that burden. Okay. So insurance deals with a lot of different things, from car insurance, home insurance, business insurance, life insurance, unemployment. Unemployment does not get involved by, does not get in, we get rid of the unemployment being in charge of the government. I mean, the federal government being in charge of unemployment from now on. That's stupid. We shouldn't do that. We should have never done that. We need to go to a free enterprise system. Insurance companies can do unemployment. And by the way, in any of these any of these insurances, especially in any of the financial instruments, especially loans and the like, one of the terms that a lot of people are going to start putting into the system is working hours in the charity economy. If you cannot make your payments, you immediately start putting hours in the charity economy, and that's going to make the whole system work better. And you don't know about the charity economy, look at that video. Okay, health insurance, Social Security, and the charity economy, all major time involved in this. Okay, why do we want to change? We already went over the accounts there. Steady lack of medical care. Why did they have Social Security in the first place? Because some people did not save up, and it became a burden on society. They got to be 65. They couldn't put good work in. They were weak. Their mind started going. They could not hold down a job, and they became a burden on society. So they way overreached, and they put a socialist system over everybody, a monopoly system over everybody. It was a disastrous monopoly system. It's very poorly run. Okay, so what we want is steady income and medical care. A rating floor is going to help with that. It's a negative externality. Some people are going to say, why do we need to do that? Nobody has to help these people. They chose not to save for their retirement. It's a negative externality to see a 70-year-old guy or woman out there on the streets, cold, in the rain, without medical care. That's a negative externality. We don't want to live in a society like that. Well, the charities can take care of them. Yes, we want the charities to take care of people who were responsible, who took reasonable steps, and then fell through the cracks after taking reasonable steps. If we have the charity system take care of everybody that didn't even do any reasonable steps, then the charity system crumbles. It becomes overburdened. It's a negative externalities when a lot of the charity dollars out there in society go towards people who did not have reasonable steps. That's why there's a mandate as a citizen ownership model of government. It's a mandate to be within this geographic area, within this governed area, to not become a burden on society, or at least a reasonable steps. Okay, we talked about the charity economy playing a big role. I like to end all my slides like this. The freedom of about a dozen CRAs. You get to choose what CRA you want to be going with. Of a couple of dozens of full systems. There's a lot of full systems out there. The full sectors, the full systems. From the healthcare systems to the charity system to the insurance system. There's a lot of systems out there. The freedom to experiment will yield great results. That is free enterprise. That is free enterprise. And when you build a free enterprise within this structure, with this a few mandates that people do not become burdens on society, or at least reasonable steps not to become a burden on society. And you force people to contribute towards the military and the rule of law and the like. It's a structure that really will show great results. So everything is everything is easy to find at Haley2024.org. Please consider a donation to this movement, and until the next video.